Hey everyone, okay, now let's go and stretch hip flexors. Hip flexors, everyone thinks their hip flexors are tight. Not true. You can have a tight hip flexor that is not working properly. Okay, you can also have a tight hip flexor that is working properly. You can have a hip flexor that is not tight and that is not working properly, and you can have a hip flexor that is not tight and working properly, which is good. So you can have many dysfunctions, and that's why getting assessed is really important. If you think you have a tight hip flexor or that you have a hip issue or anything like that, because you have to identify what is going on with this muscle. Is it actually engaging, or is it just tight and not engaging? So this is why a professional can often help you figure that out, okay? Here is a basic how to do. If you do get prescribed a hip flexor stretch, this is the easiest version, so you can start on your knees. You're gonna do a pelvic tilt, okay? So you're gonna tuck your tailbone underneath your hips, and then you're gonna move forward, okay? You should feel a stretch in here, all right? What does tucking the tailbone do? Takes out our lower back, okay? So this way our back is stabilized, and that way we don't arch our lower back, and then we don't have both points anchored when we're doing our stretch. And it's not specific to the hip flexor because now we're losing stability in other places, okay? So pelvic tilt and then move forward. You can squeeze your butt also, okay? So think, squeeze your butt, move your hip crease forward, okay? Next step, you could do this standing, okay? So same thing, tuck underneath and then move forward, okay? And you can hold for 5 to 10 breaths. If you are getting the pain while you're doing the pelvic tilt and you feel it in your back, get evaluated by a professional before moving on. So if you are feeling the pain when you're tucking your tailbone underneath, you can try and find a neutral spine, okay? Try not to arch your back when you move forward, okay? So keep your core where it is, your back straight like it was a plank, okay? And then you can move forward. So that same movement, but you don't need to tuck the tailbone underneath. Let's just try and get you moving through this movement, and you can get evaluated for it, okay?